the issue of staphylococci. You know, a lot of women out there, a lot of guys out there, they tell you, look, they send us messages and they say, this issue has been on for 8 years and staph is still, you know, prevailing. Why is it so difficult to take care of staph? In fact, some of them believe that, look, there is nothing that can be done.
Thank you very much. This is, I think this is fast becoming a public issue. Okay. I get calls also on issues of staph and all that. Okay. I think in relationship to IVF, infertility. Infertility. Staph is a footprint.
It's a footprint.
Footprint.
Okay.
And normally, I think it became so popular because of practices of alternative medicine practitioners and all that. Staph here and there. But I want to say that staph is just an infection.
It's an infection.
If it is properly identified
and treated
properly, there is no reason why it should become so chronic and popular. Right. But the issue now is this again. It is not unheard of for somebody to have one sexually transmitted infection or the other. The issue is getting a proper treatment, okay, and also treating your sexual partners.
Okay.
The pitfalls in staphylococcal infection is that, one, it is getting a very popular media attention.
Okay.
Number two, the vicious cycle involves alternative medical practitioners.
Okay.
And I think for one reason or the other, we've not been able to get proper treatment from this sector.
Okay.
Now, third, people go to laboratories where the diagnosis is the species.
Okay.
And not the actual, the group and not the species, and the sensitivity result is not accurate. Nowadays, you have machines that tells you exactly the species.
Okay. So you can,
and in few hours, it will tell you the exact drug. Yes, we've just installed one at Union.
Okay.
All right, and it is doing within 10 hours. You get that, and I was amazed when this was done. That's about 2 weeks ago.
Okay.
So when you have issues like this, and you are able to treat with the exact drug for the appropriate length of time, and the man or the woman is able to keep to the doctor's instructions. For example, treating your partner, curtailing your promiscuity, not having multiple sexual partners. Because if you are a reservoir, or your girlfriend is a reservoir of these organisms or germs, and you treat yourself, and you go back to
you get it
back.
Okay.
And you are getting it back in a worse frame, because it's going to be more serious now, because the drug that it was sensitive to before then, perhaps now the organism has learned that you are going to hit it,
so it's better prepared,
and it's now resistant.
Okay.
So these are
that is why they keep telling you that they've been treating staph for 8 years,
yes,
and there's no solution.
I had a call about 2 weeks ago, and somebody said he went to London to get treatment for staph, and I said, wow. but the issue is simple: get appropriate diagnosis, appropriate identification, and sensitivity. Okay, and keep to your doctor's instructions.
Okay, but is staph a tropical disease?
It's not a tropical disease. It's all over the world.
Okay.
You understand? But like I said, it is very popular in this part of the world.
Okay.
Popular because most men will tell you, well, I have low sperm count because I have chronic staphylococcus.
Okay, does that happen?
Yes, it's an infection, yes.
You can eat up the sperm?
Of course, yes. Okay. Of course, yes, because you have an infection which is affecting sperm production. All right?
Okay, so staph can actually reduce the count of the semen.
Yes. But I'm saying that in the rating of infections in infertility, is a footprint. There are some major causes of.
What are the major ones?
The major infections that we reckon with
are
gonorrhea, I mean sexually transmitted infections, gonorrhea, syphilis, chlamydia, and so on and so forth.
Those are even worse.
These are worse because when you have that, it will affect you and your woman, especially the woman.
Okay.
All right. These are major causes of tubal blockage.
Okay.
All right. And you know, tubal blockage is the commonest cause.
Yeah.
Amounts to more than 40% of causes of infertility in the woman.
Okay.
All right.
So one major cause of tubal blockage is infection.
Sexually transmitted
diseases
that are not treated well.
Okay. Doctor, I want to appreciate you, but before we go, I want to look at the success stories of IVF. In case, you know, people have these issues with infertility, what is the escape route? Is it not IVF? And so let us look at the success stories of IVF, especially at True Care fertility clinics.
Well, thank you very much. As much as I would have loved to give you statistics,
okay,
ethics will not permit me to say specifically about our success stories, giving figures and all that. But I want to, I should comment thus that there are factors for success.
Okay.
When a woman comes for IVF treatment. Invariably, unlike what happens in advanced countries,
okay,
where women are more civilized, more less
more
emotional,
open and
more open.
Here,
right?
everything is secret.
Yes, it's secret.
Yeah.
I know of people that have gotten pregnant 3, 4, and we ask them, could you please permit us to tell your story so that we can encourage
others?
They say no. That I say yes. Okay, you have to respect.
You have
their
to
rights.
respect their privacy.
Now,
yes.
the most important factor is the woman's age.
Okay.
And this is important in this part of the world where people rarely assess IVF treatment below 30 years.
No, it's when they are 50 that they come to
50. Recently, we had 62. Even
62.
though she's pregnant now with twins.
62 pregnant.
Yes. Yes. Now, I want to encourage our women to please come out early.
Okay.
If you come out early, it does not mean you're going to have IVF. It may be at that point you need some other
something
treatment,
else,
which is less expensive but cost effective.
Okay.
It may be that you need IUI, which is a little bit at least cheaper than IVF. But if you come at a stage where your ovarian reserve, that is the eggs inside you, is such that in quality and quantity they are not okay. For example, by fact, a woman, by the time you are temple body, you have about 400,000 eggs.
400,000.
Out of this 400,000, you need just 400 for your reproductive purposes.